If you brush your teeth, rinse your mouth, and still notice that your breath becomes unpleasant within a short time, it is natural to wonder, is the problem in my mouth or is it coming from my stomach? Many people immediately blame acidity, reflux, or poor digestion. But before you look towards the stomach, understand one fact clearly. Most persistent bad breath, medically called halitosis, starts inside the mouth. And brushing your teeth alone does not always remove the real source. Bacteria live on the tongue, around the gums, and between the teeth. When these bacteria break down proteins from food debris, dead cells, and saliva, they can release foul-smelling gases known as volatile sulfur compounds. These compounds are one reason your breath can smell unpleasant even when your teeth appear clean. One of the most important places to check is the back of your tongue. The tongue is not a smooth surface. It has tiny grooves where bacteria, food particles, and dead cells can collect. When this coating builds up, bacteria can continue producing unpleasant smelling compounds. That is why gentle tongue cleaning should be part of your oral hygiene, not something you do only when the smell becomes noticeable. But the tongue is not the only culprit. Gum disease is another important cause. Plaque can irritate the gums and lead to gingivitis. If the problem progresses deeper around the teeth, it can develop into periodontitis. Persistent bad breath can be one warning sign. If your gums bleed while brushing, look swollen, feel painful, or you notice loose teeth or discharge around the gums, do not simply cover the smell with mouth freshener. Get your gums and teeth checked by a dentist. Dry mouth also deserves attention, especially after 60. Saliva helps wash the mouth and control bacterial buildup. When saliva production decreases, odor-producing bacteria and their compounds can accumulate more easily. This is why morning breath is common after several hours of sleep. But persistent dry mouth can also be linked to dehydration, mouth breathing at night, certain medicines, or underlying medical conditions. Now, here is where the story becomes more interesting. What if your dentist checks your teeth, gums, and tongue and says everything looks healthy, but the bad breath still continues? Could reflux, H. pylori, or another digestive problem be responsible? Stay with me, because that is what we need to examine next, and this is where many people start treating the wrong problem. So if your teeth, gums, tongue, and oral hygiene are all in good condition, the next question becomes important. Can a digestive problem contribute to bad breath? The answer is yes, but far less often than most people believe. As a gastroenterologist, I see patients who have already visited a dentist because of persistent bad breath. Their teeth have been examined, their gums look healthy, and there is no obvious oral cause. Some have also been checked by an ear, nose, and throat specialist because they suspected sinus problems, postnasal drip, tonsil stones, or repeated throat irritation. When those causes are ruled out, people naturally start wondering whether the problem is coming from deeper inside the digestive system. One gastrointestinal condition that deserves attention is gastroesophageal reflux disease, or GERD. Normally, food moves from your mouth through the esophagus and into the stomach. A muscular valve at the lower end of the esophagus helps prevent stomach contents from traveling backwards. With reflux, this barrier does not work properly, allowing stomach contents to flow back into the esophagus. Sometimes reflux can travel high enough to produce a sour or bitter taste in the mouth, regurgitation, throat irritation, or frequent throat clearing. In this situation, reflux can contribute to unpleasant breaths. But understand the distinction clearly. Having bad breath does not automatically mean you have GERD, and having acidity does not mean that the smell is simply rising from your stomach. Reflux becomes more relevant when bad breath occurs together with a clear pattern of other symptoms. Ask yourself a few questions. Do you regularly experience burning behind the breastbone after meals? Do you notice sour or bitter fluid coming into your mouth? Does food seem to come back up after eating? Do you repeatedly clear your throat? Are your symptoms worse after a heavy dinner or when you lie down soon after eating? If several of these symptoms occur together, reflux deserves proper attention. And after 60, repeatedly treating these symptoms with random home remedies is not a good strategy. The important question is not simply what can remove the smell. It is, why am I repeatedly getting reflux and does it need proper treatment? Your daily habits can also make a difference. Avoid very large late night meals. If reflux troubles you at night, try to finish dinner at least 3 hours before lying down or going to bed. If certain foods repeatedly trigger your symptoms, recognize your own pattern instead of unnecessarily avoiding dozens of foods. But reflux is only one possible digestive connection. There is another stomach condition that receives enormous attention in India: infection with a bacterium called Helicobacter pylori or H. pylori. Studies have reported an association between H. pylori infection and halitosis, and bad breath has improved in some patients after successful eradication. But this is exactly where people make a serious mistake. Bad breath alone does not mean you should start H. pylori antibiotics. In the next part, I will explain who should actually be tested for H. pylori, why proper testing matters, and why taking antibiotics without confirmation can create more problems than it solves. Now let us talk about H. pylori, because this is one of the most misunderstood connections between the stomach and bad breath. Helicobacter pylori or H. pylori is a bacterium that can live in the lining of the stomach. It is an important cause of chronic gastritis and peptic ulcer disease, and long-term infection is also linked to an increased risk of stomach cancer. H. pylori is common in India, but that does not mean every person with bad breath has this infection, and it certainly does not mean H. pylori is causing the smell. Testing becomes more relevant when there are proper gastrointestinal indications. Someone may have persistent upper abdominal discomfort, recurrent indigestion, a history of peptic ulcer disease, or other symptoms that need investigation. And if you are over 60 and develop new or persistent indigestion, unexplained weight loss, repeated vomiting, difficulty swallowing, black stools, or signs of gastrointestinal bleeding, do not simply order an H. pylori test yourself and stop there. You need proper medical assessment because the priority is to understand what is happening inside the stomach. H. pylori can be detected using a urea breath test or stool antigen test. It can also be identified from stomach biopsies when an endoscopy is required. The choice and timing of the test matter. Proton pump inhibitors, recent antibiotics, and bismuth can interfere with testing and produce a false negative result. If active H. pylori infection is confirmed, it should be treated with an appropriate eradication regimen. Do not copy somebody else's antibiotics or take an old combination simply because it worked for them. Antibiotic resistance is a real problem, and treatment is not the end of the story. After completing therapy, eradication should be confirmed with an appropriate test of cure, usually at least 4 weeks after treatment. Feeling better does not prove that the infection has disappeared. If you find explanations like this useful, subscribe to the channel. My aim is to help you understand what your symptoms actually mean before you start treating the wrong condition. Now let us move to another digestive problem that is sometimes blamed for bad breath: gastroparesis. Gastroparesis means the stomach empties more slowly than normal even though there is no physical blockage. People can experience early fullness, nausea, vomiting, bloating, upper abdominal discomfort, or feeling unusually full after eating only a small amount. It is especially important in people with diabetes because diabetes can damage the nerves involved in normal stomach movement. Certain medicines can also delay stomach emptying or worsen similar symptoms, so the medication list needs to be reviewed carefully. But here is the important point. Bad breath is not a defining symptom of gastroparesis. In some patients, repeated regurgitation or vomiting can contribute to an unpleasant smell or taste. But if somebody has bad breath alone, it is not reasonable to conclude that food is simply sitting in the stomach and rotting. That popular explanation is wrong. And the next condition is even more commonly misunderstood online: SIBO, or small intestinal bacterial overgrowth. Now let us come to SIBO, because this is one of the conditions people increasingly blame for bloating, gas, and bad breath. SIBO stands for small intestinal bacterial overgrowth. Normally, the small intestine contains far fewer bacteria than the colon. In SIBO, there is an abnormal increase or change in bacteria within the small intestine. SIBO can be associated with symptoms such as bloating, abdominal discomfort, excessive gas, diarrhea, and, in more significant cases, nutritional problems. But here is the important part. SIBO should not be diagnosed simply because you have bloating and bad breath. Recent research has reported an association between SIBO and extraoral halitosis in selected groups of patients. That is scientifically interesting, but the evidence is still developing. It does not mean SIBO is a common hidden cause of every case of bad breath. So when should it be considered? If your dentist has ruled out oral causes and you also have persistent digestive symptoms such as significant bloating, abdominal discomfort, altered bowel movements, or symptoms suggesting a motility problem, then a gastroenterologist may decide that SIBO testing is appropriate. One commonly used non-invasive approach is breath testing after glucose or lactulose, with both hydrogen and methane measured in the breath. The test looks at gases produced after you drink a specific sugar solution, but breath testing has limitations. So the result has to be interpreted together with your symptoms and medical history. This is why I do not want you to decide that bad breath means SIBO and start taking antibiotics. Unnecessary antibiotics can disturb the gut microbiome, cause side effects, and contribute to antibiotic resistance. If SIBO is genuinely present, treatment should also include understanding why it developed, because treating the bacteria without addressing the underlying problem can allow symptoms to return. And there is one myth I want to remove completely. Bad breath does not usually mean that food is sitting inside your stomach or intestine and rotting. Your digestive system is not a container where yesterday's meal simply remains and produces a smell that travels straight into your mouth. Digestion involves stomach acid, digestive enzymes, intestinal movement, absorption, and microorganisms. The right question is not, what is rotting inside me? The right question is, where is the odor actually coming from? For most people, the answer is still the mouth. In a smaller group, reflux, H. pylori, delayed stomach emptying, SIBO, or another medical problem can contribute. But these conditions need to be identified from the full pattern of symptoms, not guessed from bad breath alone. If this explanation has helped you separate fact from fear, write bad breath in the comments. That tells me you want more practical videos where we examine common digestive myths using science. Now we have reached the most useful part. If your bad breath keeps returning despite brushing and mouthwash, what should you actually do first? Which tests make sense? Which treatments should you avoid? And which warning signs mean you should not delay getting checked? That is what I will give you next, step by step. Now let us put everything together into a simple plan you can actually follow. If your bad breath keeps returning, do not begin by blaming your stomach. Start with the most common source, the mouth. Brush your teeth twice a day with fluoride toothpaste. Clean between your teeth every day and gently clean your tongue, especially towards the back where coating can build up. A suitable therapeutic mouthwash can help, but it should not replace brushing, interdental cleaning, and proper dental care. Pay attention to dry mouth as well. Drink enough water through the day. If you regularly wake with a very dry mouth, breathe through your mouth at night, or take medicines that reduce saliva, discuss this with your dentist or doctor instead of simply covering the smell with mints. And avoid tobacco. It can worsen oral health and make bad breath more difficult to control. If the smell continues despite good oral hygiene, get a dental examination. Your dentist can look for gum disease, tooth decay, tongue coating, infections, poorly fitting dental work, or other oral causes that you cannot see yourself. If no clear oral cause is found, or if significant digestive symptoms are present at the same time, then a gastrointestinal assessment may be appropriate. If bad breath comes with repeated heartburn, regurgitation, persistent upper abdominal discomfort, early fullness, vomiting, or significant bloating and bowel changes, speak to a gastroenterologist. The correct test depends on the complete symptom pattern. Do not start H. pylori antibiotics because a friend took them. Do not assume bloating means SIBO, and do not repeatedly take antibiotics hoping they will clean the gut. The wrong treatment can create new problems while the real cause remains untreated. There are also warning signs you should never ignore, especially after 60. If you have unexplained weight loss, loss of appetite, persistent vomiting, difficulty or pain when swallowing, vomiting blood, black tarry stools, or persistent abdominal pain, get medically assessed rather than treating bad breath alone. The good news is that persistent bad breath is not something you simply have to accept. With a careful step-by-step approach, the cause can often be identified and managed. Start with your mouth, look for accompanying symptoms, investigate only when there is a reason, then treat the cause, not just the smell. If this video has helped you understand bad breath more clearly, give this video a like and share it with someone who has been struggling with the same problem.